Hi, everyone, and thanks so much for joining us. My name is Marian Marlowe, and on behalf of Jewish Federation of Greater MetroWest, I'm pleased to welcome you to today's webinar. Just a couple of notes before we get started. If you have any questions, please feel free to type them in the chat feature, and we'll try to answer as many as we can at the end of the webinar. Also, any links that are shared on the screen during today's presentation will be included in a follow-up email. Today, we will get to hear from two of Federation's partners and from the Grata Fund for Senior Care about their responses to the COVID crisis. But first, just a little bit of background. At the outset, I think it's fair to say that the importance Federation assigns to addressing the needs of older adults really is demonstrated simply by the fact that Federation has designated a department, the CARES department, that I coordinate, which is charged with learning about the needs of older adults in our community so that Federation's allocations and planning functions are strategic and informed, creating a broad network of services, and convening Federation's 11 local partners that you see on the screen now in order to promote collaboration and exchange information. We convene these partners on a regular basis, and recently we were very pleased to welcome a representative of the Jewish Community Foundation's Grata Fund for Senior Care to our meetings to provide for the further exchange of information. Together, Federation and its legacy and endowment arm, the Jewish Community Foundation, have worked to support our community's seniors for many years, and especially during the COVID crisis. I want to back up for just a moment and address a question I hear often. What's a senior for Federation's purposes? What's an older adult? And the truth is that while some government programs are based on age, at Federation, we recognize that senior or older adult means different things to different people. Our philosophy at Federation really doesn't require us to name an age. And our community is diverse. It includes seniors who might be classified as vulnerable, maybe because of their health situation, maybe because of their financial situation, but it also includes older adults who are quite independent. It includes Holocaust survivors, it includes Russian speakers, and people are sometimes surprised to hear that we may have two generations of seniors in our community. It's not out of the question to get a phone call from a 70-year-old calling about his or her parent. While we don't have precise demographic information, census data tell us that in 10 short years, 1 in 5 of us in New Jersey will be at least 65 years old. And it's very likely that the Jewish community is skewing a little bit older than that. The philosophy that we at Federation promote is that seniors, older adults are not other people. And I try to think about what kind of community do I want to age in? I often say to people that seniors is a cohort that we're either in, it's the one cohort that we're either in or want to be in someday. Before March of this year, Federation's work around seniors focused on some broad issues. We looked at transportation, we looked at the issue of elder abuse, which is surprisingly and unhappily quite common. And I'm pleased to say one of our agencies now has a very effective program addressing it. And we looked at the needs of Holocaust survivors. Those are some examples. And then of course, COVID hit New Jersey in March. And the senior community was especially hard hit for several reasons that were widely reported. Medically, older adults may have been more likely to be vulnerable to the virus. There were particular challenges for those living in group settings. Technology was an issue for some seniors, both because some of them didn't have technology that would connect them to the outside world. And sometimes even when seniors had it, they weren't so comfortable using it. And unfortunately, this really led to a perfect storm for social isolation, which was um, an issue before COVID and only was exacerbated afterwards. But because Federation had an infrastructure in place and had strong partnerships in place, it was able to move quickly. It was able to, on several fronts, it allocated funds from its emergency reserve fund. It changed its annual allocations process, did particular work around the isolation of Holocaust survivors. It connected seniors, both in our community and in others, because of the Federation system, to services. And it put in place several volunteer programs that served seniors. I think it's fair to say that really, without exception, all of our Federation partner agencies did tremendous work over these past few months. And today we will get to hear from two of them who will highlight their work. So now I'd like to introduce Susan Grosser, the Executive Director of Daughters of Israel, the skilled nursing facility in West Orange.
Thank you, Marian. So good afternoon. I'm Susan Grosser. I'm the Executive Director here at Daughters of Israel. I've had the privilege of calling Daughters my home for over 21 years, and I've had the honor of being the Executive Director for 13 years. And in addition to introducing myself, I would like to introduce you to an N95 mask. And this has been our companion for over the past 3 months. It's been a really long haul, to say the least. However, as of today and for the past few weeks, I'm happy to report that Daughters of Israel is coronavirus free. We have no cases of COVID-19 amongst our residents or our staff. More than 40% of the coronavirus deaths in New Jersey have been in nursing homes. Why have nursing homes been hit so hard? It's because we face the toughest challenge of caring for the most vulnerable population, our elderly and our seniors. The average age of our resident here at Daughters is about 84 years old. Many of them have pre-existing health conditions. While we still fared much better than many other nursing homes, and we instituted every safety measure that we could, we still had 60 of our residents come down with coronavirus, and we had 19 of them pass away. The loss of one of our residents is very painful. But when this number is magnified, it is so devastating on so many levels for us. We're very grateful to the Jewish Federation of Greater MetroWest for its generosity to Daughters during this pandemic. We utilized funds granted to us through the Wilf Family Foundation and the Federation Emergency Reserves to purchase mass quantities of PPE, or personal protective equipment, including surgical masks, N95 masks, additional gloves, isolation gowns, face shields, eye goggles, disinfecting agents, and hand sanitizing stations. We also had orchestrated our own fundraising drive, spearheaded by our immediate past president, David Silverstein, which assisted us in raising additional much needed funds. Our Board of Governors also has been extremely supportive during this time, giving donations to our emergency fund for gifts for our staff. We continue to be very, very concerned with the spread of this virus. Since day one, we've been and continue to follow all the guidances from CDC, CMS, the Health Commissioner, and the New Jersey Department of Health. From March 12th on, we've had no group activities, no communal dining, no live religious services. Our gift shop has been closed, our beauty shop has been closed, our coffee shop has been closed. Every activity, from eating their meals to receiving physical therapy, takes place in the residents' rooms. You can only imagine the heightened responsibility for our staff members. We've been very creative though. For instance, over Passover, Rabbi Carpel pre-recorded the Seder service, and we broadcasted it through the facility on the residents' TVs. Every resident was given a Seder plate and a Haggadah to follow. We also try to take residents out of their rooms individually with masks on in the nice weather for fresh air or for activities like Cinco de Mayo, going outside, gardening. No visitors, including vendors, volunteers, and family members, are allowed into the building. In order to enable communication between our residents and their families, we have our staff facilitate FaceTime and Skype calls. Families are allowed an exception for compassionate care visits, but this is only when their loved one is at the end of life. And at that time, they're allowed to come in with a multitude of precautions. Starting a couple of weeks ago, we began scheduling 15-minute face-to-face outdoor visits for our families and our residents. But these, again, are under very strict restrictions. Everybody has to sit 6 feet apart. Everybody has to wear masks. Families have to sign COVID waivers, and everybody has to have their temperature checked. During this pandemic, we had 51 staff members that came down with COVID. Under the guidance of the Department of Health and the Health Commissioner, we have mandatory COVID testing now every week for all of our residents and all of our staff. Everybody gets a nasal swab that is sent into the lab for testing. All staff members also must have their temperature taken upon entering the building every day, and every staff member is required to wear surgical and N95 masks all day long throughout the building. We've had to do a lot of appreciation for our staff. We've given every staff member pandemic pay with their paychecks every week of $250 a week since the beginning of April. We've also had different staff appreciation days. We've given groceries to go, new scrub sets, dinners to go, and different gratitude caravans. The staff really enjoyed when the Federation came through on their Federation Gratitude Parade and also handed out gift cards to every staff member working here. At the end of the day, it's really our staff. They're the healthcare heroes that helped us make it through this crisis. We continue to work proactively and diligently to do everything possible to protect the precious lives of those entrusted in our care. We still report daily to the Department of Health and follow all the guidelines set forth from the CDC, CMS, and the New Jersey Department of Health. I'd like to think we've made it through the worst, but unfortunately, we all know there's a resurgence expected. Many US states are already seeing dramatic rises in the cases as restrictions are being lifted. With continued testing and adhering to recommended restrictions, and with proper precautions and emergency preparedness in place, we pray that we'll be able to control any future outbreaks within our home. The community has been extremely generous to daughters through these harrowing months. Our home has faced extreme financial hardship during this time, with the added expense and reduced revenues due to decreased census. We had already downsized from our original capacity of 303 beds to 254 beds last year. At the beginning of this pandemic, our census was hovering around 215 residents. Our current census has been averaging at about 175 residents, and our admission referrals are very few. People are not having their elective surgeries, so short-term admissions are down. Families are not making the difficult decision of long-term care for their loved ones during this time. We expect these trends to change slowly over the next few months, but in the meantime, we're operating at a much lower census and have had to modify our projections considerably. Continued fundraising and the community's support will be key for our future. In summary, this pandemic is like nothing I've ever experienced in the 39 years that I've been working in nursing homes. It's been physically, mentally, and emotionally exhausting for our residents, their families, and our staff. Normally an optimist, I would love to say this is behind us. but I'm also a very practical person, and I know that's not the truth. We'll continue to do everything we can in our power to keep our seniors and staff safe, well cared for, and hopefully virus-free. Thank you.
Thank you so much, Susan, and not just for the presentation, but I want to say publicly, thank you so much for everything you and your entire staff has done for our community over the past few months.
Thank you.
Now I'd like to call on Gina Goldman, the Director for the Center of Adult Enrichment at the JCC MetroWest. As I mentioned, one of the serious problems facing many seniors is social isolation. And for many seniors, the JCC has provided an antidote to this problem. Gina?
Thank you, Marion. Before I start, I actually do just want to thank Susan Grosser. My mother-in-law is at Daughters, and she is well cared for, happy, and the video and the FaceTime calls are just amazing for our family. So thank you publicly to Susan. And now I'll get on to the JCC. When the whole thing started, the whole pandemic, I don't think the people at the JCC, our staff, believed anything that was happening. It was our big week. We were going to have a Purim concert on March 12th. We were expecting 300 seniors at the JCC that day. The next week was opening night of the Jewish Film Festival. It's one of the biggest events of our year. I think all of a sudden we started hearing the rumors. We didn't want anybody to get sick. We were concerned about safety, so we immediately convened and we debated what we should do about the concert and the film festival, and we decided to cancel the concert, postpone the film festival. In a million years, I would never imagine that afternoon sitting here now talking about this the way I'm talking about this. Our other programs, we had to consider them also. We operate a senior center. We have the Littman Center for people with memory impairment. All of these daily programs had to be considered. We thought we were going to be home for about 2 weeks. And then also our Kosher Meals on Wheels program. We had to think about that. Let's send home some extra meals. And so we did. That weekend, we sent home a few extra meals. Who knows where we're going to be, in a couple of weeks, but let's just make sure that everybody gets some extra meals. Then our group got together, our staff got together, and we said, what if we're not back quickly? Let's do a worst case scenario. What can we do if we're going to be home? We want to keep our people engaged. We want to keep tabs on them. So we met and we all said, what can you do from home if you had to? I could do a Zoom. I can do a trivia class. I can do an exercise class. We really brainstormed, and we came up with things. What you're looking at now, the page you were previously looking at was what we put together. What you're looking at now was one of the resulting things. We actually had a Passover Seder from the Sharon Gordon's our assistant exec, and from her home, we had a Passover Seder where 60 seniors were able to join us. We moved on, and we had to spread out to our other satellite centers that we have. We operate satellite centers in Morris County and Essex County at different synagogues. That staff was mobilized, and we started making phone calls, and we were checking in with people. And this is where we realized, and where we started to collaborate with Federation, and Federation came right in. And we had a list of probably 400 seniors at that point that needed to make phone calls made to them, or needed to be connected on Zoom or what have you. Federation mobilized volunteers, and we gave them our list, working with their staff and our staff together. And we were able to call these people, and these friendships are all still going on right now. Marion described it in her intro. Marion at one point said she'd love to have a big party someday where the volunteers and the people that they're calling get to meet each other. We got in touch with our Littman members, that's our memory center members, and we started sending out to their families activity packs to keep them stimulated. At first, we were just making phone calls to those families. Then we started in with Zooms, and today we have 3 times a week. We have 25 to 30 people. We just shut one down right before this started. 25 to 30 memory center people on our Zooms with the director participating in all the programs that they're used to when they come to our memory center. But of course, our programs, our memory center program is 9:30 to 3:30, 3 days a week. It's a respite program. They can't sit in front of a Zoom for that long. These programs that we're providing are only an hour each. I mean, each 3 times a week. You know, we are doing, you know, what we can do within the parameters. Another thing that happened at the beginning, for the first couple of weeks, the JCC was all on staff, all the staff was getting paid. Then we started to have to put people on furlough. And even though people were fully furloughed, 25% furloughed, 75% furloughed, they all stepped up. Everybody kept working, kept providing these programs. We wanted to keep everybody engaged, and we wanted to keep everybody together. The other place where Federation greatly helped us was, can you imagine connecting all of these people and the problems that they were having? At our suggestion, Federation put together a tech hotline, and we were able to refer people to this tech hotline, and they could get on Zoom, they could get their workout, whether they have a camera or not, or whatever. It all seemed to work out, and it was with Federation's help that we got through having the number of people that we had to handle at one time. So what happened with these Zoom programs, I thought we were just going to keep people connected and entertain people. They have really become a lifeline. Through the phone calls and the Zooms, we found out people weren't getting errands taken care of. They weren't getting their medicines. They weren't getting their food. I was sending out an email reminder every night, and I was adding in, these restaurants are sending home deliveries. These kosher restaurants can send kosher food to your home. And I was putting my phone number. People were calling me and saying, I can't get insulin. So we spoke to Federation again, and Federation put up the I Need Help hotline. I could sit in my kitchen, put people's names into the I Need Help, and someone was helping them the very next day. It was really a godsend. Thank you so much. We also needed, of course, some, these notes are some notes of thank you from some of our kosher nutrition people. We realized that we needed to send home some shelf-stable meals, in case we collaborate to do our kosher meals program with Daughters of Israel and Jewish Community Housing Corp. Jewish Community Housing Corp cooks the food. Daughters of Israel provides the drivers that deliver the food. What if somebody got sick? We sent home shelf-stable meals so that we knew that people were covered. We also needed money. All of this stuff costs extra money. We needed masks, which were provided by Federation. We needed more PPE. We needed money to help us increase the number of kosher meals on wheels that we were sending home. Before this, we operated a congregate meal program where up to 80 seniors could come have lunch at the JCC. Some of the more lower income people that came for lunch every day were not able to get food. We had to relax our qualifications for Meals on Wheels and allow these newly homebound people, because they're afraid to go out or whatever, to be able to receive our Meals on Wheels program. So there was fundraising that was necessary, and we needed money for that, and Federation stepped up, and we were helped with that also. They wanted me to talk about, also, I would like to talk about how many people were connected before and how many people are connected now. And like I said, we had many programs. The JCC figures that through our senior centers, the memory center, our satellite programs, we probably touch about 1,500 unduplicated seniors a year. We also run day trips and overnight trips. In fact, we were in South Africa in February with 90-year-olds, and we came back to this. Those people were all contacting us and receiving our emails and our notices. And what we found is two separate things were happening. some of the more frail and older people that were not able to participate by coming to the JCC now could participate. They were here by Zoom. It's opened up a world for some of these people. So looking forward to the future, when and if we open up, which I'm going to talk about in a minute, we'd like to keep some of this going. And that's going to take money and equipment and staff and whatever to keep some of the Zoom stuff going, because it brings back the more frail and the more isolated. On the other hand, one of our memory center caregivers has told us that she feels that this isolation has caused a rapid decline in her husband's cognitive ability. And this is heartbreaking. We would love to open, and we are now seeking some additional funds from GRADA, because we think to keep everyone safe, we really have to take our senior population, our more frail population, out of our building. Our building is too small for everybody to be there. We have the special needs program, we have early childhood, we have the fitness members. So we've started speaking to Temple B'nai Shalom in West Orange. They have a big social hall. We'd like to bring our programs over there. They can give us classroom space. They can give us the social hall. We can serve our lunch program there. And we'll need equipment, staff, more PPE. We'll need rent. And we've come to Federation, we've come to GRADA, and we've applied for a grant so that if we had to, we will take our people over there. I think that's going to be the plan. That'll be the safest for everybody. Where do we see us going in the next 3 months? Hopefully for the seniors, we can open up, and we can open up safely, or who knows, we may have to roll back. We really don't know. What I can say is that last night was the opening movie for our virtual Jewish Film Festival. We had our first meeting with one of the filmmakers this morning. It was a big success. We had 56 people on, and we're just working as hard as we can, even though, again, we have all been furloughed again as of last week. We're at 50. Most of the JCC staff has been totally furloughed. A few of our essential workers are 50% furloughed. So we're still working, and we're still bringing the programs. And
Gina, thank you so much, Gina.
thank you.
And not just for the presentation, but for really everything you've done to stay connected to all of the seniors who are part of the JCC program.
Thank you again to Federation for the collaboration, and to all the other community members that have helped us get through this. Thank you all.
Thank you. Now I'd like to introduce my colleague, Rini Carniel, the director of the GRADA Fund for Senior Care at the Jewish Community Foundation.
Good afternoon. And I'd like to also thank the two speakers before, Susan Grosser and Gina Goldman, for all the good work that they are doing for older adults. It was March 9th, 2 days before the GRADA Fund for Senior Care and its partner funder, the Henry and Marilyn Howe Foundation, were to hold an all-day in-person Advancing Age-Friendly Communities Conference at the Federation with more than 100 attendees and 25 speakers from 6 states. We realized this could not happen. Instead, the GRADA Fund for Senior Care and its council members called an emergency meeting to discuss ways to respond to the COVID-19 pandemic. The GRADA Fund for Senior Care is an advisory council of JCF, created from the sale of the Teresa Grada Rehabilitation Center and Nursing Home. Functioning as a donor-advised fund, the council is comprised of 14 members, some from the original board of the nursing home and all from the greater MetroWest community. In fact, Jeff Bramer, who serves on the JCF board and the investment committee, is also the great-great-grandson of Teresa Grada and is a past president and its treasurer. All members exude a passion for the well-being of older adults. Decisions are made collectively. Let's just stay on the first slide, please. From learning together to setting funding priorities and selecting grants. All selections are intentional, aimed to further the GRADA mission of helping older adults age in place with dignity and independence in communities within our catchment area. This area includes Essex, Union, Morris, Sussex, and Eastern Somerset counties. With JCF providing grant management and investment services, the council can concentrate on grant making and stewardship. Before the pandemic, GRATA funding was focusing on program support for social connectiveness, responding to social isolation, which is a challenge facing 1 in 4 older adults, and probably more now. We also supported ways to improve access to healthy food for older adults, especially in Newark, as well as volunteerism among older adults. Our major initiative is to establish age-friendly communities, supporting improvements in the livability of towns for older adults, ranging from improved walkability, transportation, communications, and civic engagement. And then the coronavirus unfolded. What now? So next slide. First, we called all of our grantees and encouraged them to pivot their grant funds to meet coronavirus needs. Changes included funding new technology for Holocaust survivors who are JFS clients in Central New Jersey and additional meals for JFS Metro. Instead of socialization programs, our grantees established extensive ways to make phone reassurance calls. A hospital discharge home visit program was changed to having the community health workers making reassurance calls to discharge COVID-19 patients. And our age-friendly community coordinators work with the town mayors and leaders to deliver meals, communicate information, and coordinated services. Next, we listened to the needs of the Federation. Next slide, please. At our March 19th emergency meeting, Roberta Schoenberg, the president, and its members echoed, the GRATA council members are eager to be at the forefront of meeting our Jewish community's vital needs currently. GRATA immediately granted Federation $20,000 to afford additional kosher meals on wheels, Passover meals, and gift cards for older adults who are Essex and Union County residents. We were pleased that these funds were matched with $10,000 from JCF endowment funds through its grant review committee. In addition, as the needs for additional hours of chaplaincy became apparent during the pandemic surge, GRATA approved $10,000 to Federation's chaplaincy. We knew this would benefit patients, their families, as well as healthcare workers at this difficult time. Third, we supplemented our Lifelong Elizabeth initiative led by JFS Central New Jersey to work with the City of Elizabeth for additional food delivery. Our next effort was to find a way to supplement and leverage funding from another funder to benefit our grantees. The Community Foundation of New Jersey's Pandemic Relief Fund, which involves Governor Murphy's wife and multiple funders, provided support initially to address food insecurity, and it awarded a grant to one of Newark's lead food pantries, St. James Social Service Corporation, also a GRATA grantee. So we supplemented this with grant funding to them. Lastly, we initiated a new grant cycle that will support the needs of agencies related to COVID-19 for August through December, with decisions to be made shortly. This week, 2 grantees of GRATA informed us of receiving Community Foundation of New Jersey pandemic relief funding. One is a food distribution agency supporting Newark's elderly, and the second is a Federation social service agency. This will put them on the top of our list for supplemental funding in the new grant cycle. Our age-friendly conference that I mentioned in the beginning is now rescheduled to be held virtually over 4 different sessions beginning mid-September, and will address age-friendly communities with new relevance due to the pandemic. We welcome your attendance. As shown in the last slide, it is gratifying to see the acknowledgement of our grantees for our support. GRATA is pleased to support older adults in the greater MetroWest Jewish community and beyond, ready to respond to this pandemic. We're committed to continuing the Teresa GRATA legacy. In Pirkei Avot, it says, one of the 3 pillars on which the world stands is Gemilut Chasadim, acts of loving kindness. Through the GRATA Fund, we reach out to honor and care for the elderly among us. Thank you for listening. And again, it's a privilege to present with Susan and Gina to all of you today.
Hi, my name is Kim Hirsch. I'm the Executive Director of the Jewish Community Foundation of Greater MetroWest. I'm delighted through our Center for Strategic Philanthropy to be hosting today's webinar. Thank you so much to Marion and Susan and Gina and Rini for those very informative presentations and beautiful words. Your care and thoughtfulness and heart and incredible dedication of both you as individuals as well as the Federation Foundation, Grata, and Daughters of Israel and JCC it really shows through in these presentations. I will please add any questions that you might have. I'm now speaking to the participants. Please add them to the chat. I have a couple questions, but if you have questions for any of the speakers or all of the speakers, just add them to the chat. I'm following along. Just one question up front. I think this is really for Gina and for Susan. What keeps you up at night?
Everything.
I mean, a lot, I would say, but yeah. So
Everything.
one at a time. Gina, you want to start? Yeah.
No, let Susan start. That was just.
Susan. Okay. Susan.
You know, this has been totally unprecedented. Again, like I said before, I've been doing this almost 40 years. I've never seen anything like this. What keeps me up at night? Making sure my residents stay safe, making sure my staff stays safe, making sure my residents don't get depressed and feel so self-isolated, making sure my family members are being kept well informed of what's happening, making sure that we're following all the rules and the regulations and that we have enough personal protective equipment. When you finally do fall asleep, you crash. It is just exhausting.
Yeah, thank you. Yeah, Gina. Yeah.
Yeah, I mean, I don't have anywhere near the responsibility that Susan has. And I said to Susan when we first got together about this, I don't know how you got through this. I really don't. And I appreciate it personally also. I mean, like I said, my mother-in-law is there and we worry about her day and night. And that's one of the things that keeps us up at night. And about my members and my people who are my friends. They're my, I worry about all of them. Unfortunately, during this thing, we have actually lost 26, 28, I think, seniors connected to the JCC in one way or another. We're trying to support their other friends because they're isolating, because they, you don't know how people caught it and got it, and they're the most vulnerable population. And I worry about the sense of isolation, and we would like to open up and let people in, and how do we do it safely? And it's like a snow day. The seniors, we did a survey, and the answers were, I would come back to the JCC if you open, because I know the JCC will do the right thing. Hopefully we'll do the right thing and open up when it's appropriate and do the right safe measures and have everybody back and seeing their friends and still able to support those who choose not to come back. And how do we do that? The JCC has lost its income. I mean, some members, thank you to those members, they have kept paying their monthly membership. A lot have dropped. Early childhood is a big money raiser. Of course, camp, all of these things, all of those, we're a deficit department. Where are we going to be? We were a deficit department before COVID. How can we complete our mission in this situation? I thrash at night. Will the JCC be there? That's right. my stomach.
Yeah, and just to follow up with that. Wait, hold on. I'm reading questions. Sorry. What will happen if there is a resurgence or this goes on for a year or 18 months or longer? Like, what is going to happen with your agencies? Susan, can you continue to go on like this? And then Gina, and I'm also going to ask Rini, what will happen? Will Grata continue to pivot? So let's start with Susan. Yeah.
So yes, I mean, what choice do we have? We have our seniors to take care of that are here. We have those that are going to end up in the hospital that are going to need nursing home care. So we continue to stockpile. I have an entire room that is set up with personal protective equipment that every day I do an inventory on to make sure I have enough masks and gowns and everything that we need. And we'll just have to continue doing this. It's the saddest part is keeping our residents and our families separated. It is very, very painful and very sad.
Yeah. Yeah. Do you foresee other ways of bringing them, making that connection, assuming that this could go on for a long time? Yeah.
Well, until we receive regulation, because we are so heavily regulated, right now we have these outdoor visits set up and they're time limited and they're by appointments only, and it's very difficult. And you
Right.
can't hug anybody, you can't touch anybody, you can't give your mother, your father, you can't give them a hug.
Yeah. It's very painful. Gina, you in answering this question, you also have another question in the chat. Are the days of JCC travel over? So
I
both
hope
questions.
not.
Yeah.
Oh, the JCC travel is one of our biggest pleasure. I mean, we took a group on the mission, and like I said before we even got on here, I still get emails and thank yous from people that came on that mission with us to Israel, the Federation mission. And we were in South Africa in February, and we have a following, and we're able to take the more frail and not the very frail, but the people that can still travel are very comfortable traveling with us because they know we take care of them, and it brings a new experience and life to them. So I hope not. I mean, the other thing, where do I see this going? Look, Monday the 6th, early childhood is opening with a very few children as like kind of a daycare center for the summer. Our Camp Dini Reback up in Flanders is opening completely outdoors. And we're hoping to have a day. I mean, the plans are in place. We are bringing children up, 20 children on a 55 passenger bus. These things are being done to keep the JCC going. We've opened some fitness classes, Fitter on the Roof. And you can make isn't that cute? Miracle of Miracles.
Yeah.
Fitter on the roof of the JCC. And so we are, we're hoping to keep members paying their membership. I hope, and hopefully if we have the funding, we'll keep doing the Zooming and we'll keep people connected that way if we can't open safely. I'm hoping for everything. I'm hoping that there's a vaccine. When we did our survey, everyone said if there's a vaccine, we'll come back, we'll travel with you. So we had 38 people going to Jewish Italy on May 11th. And of course that didn't happen. And those people are, they're saying they want their money back, of course, but they're saying they will travel with us again. So that's wonderful. We had Jewish Morocco planned for November, October. We're putting it off to March, and people are saying, keep my deposit, please. We'd love to travel with you again.
Great. I'm going to just continue on for a few more minutes with questions, and then I'm going to wrap up. I just wanted to kind of let everybody know we're going to be wrapping up within about 5 to 7 minutes, in case if you're hanging on. And also a poll will come up for those taking part. And so it takes you like 3 seconds, just answer the poll. It'll pop up on your screen. There it is. So please answer. One more question, and then I want to get to Rini and Grada. One more question. And that is, are there specific mental health or educational programs that would be most helpful? I think this is really for Susan and Gina, and then we'll get to Rini.
Well, we know that we are referring, we're referring a lot of people to Jewish Family Services bereavement groups. We do have some other programs where people are calling in, our other Zooms. I mean, they're keeping people distracted. And I think but maybe there could be some more. That's actually, maybe Rini can answer that. I'm mostly referring people to Jewish Family Services who really are having problems. I mean, we have our weekly meditation program, our wellness programs. We had Nurse Karen Frank come on, and she did a Zoom on coping with all of this and how to behave now that some things are opening up. So we are providing those services, but I think a lot of places are providing those services also.
Right. I will add that we do have a webinar on mental health coming up on August 13th. So there will be a lot more information on that one.
We did a lifelong learning on mental health provided to us from St. Barnabas, and it was very well attended and well received.
Right.
Can I just add that for anyone on the webinar should know that the first stop for any mental health issue should be your local JFS. So JFS Central and Union County and MetroWest and Essex and Morris, and that really should be someone's first phone call for any mental health issue, other than an emergency. They're not, they're not a 911, but that is our primary referral.
Right. Okay. I just wanted to let Susan answer that question as well in terms of what program, are there new programs or whatever that could be helpful, either mental health or educational? And then I'll go to Rini.
So, our staff, a lot of our staff are unionized, so they work a lot with the union and the mental health benefits through the union. Our rabbi has been very beneficial to our staff and our residents here, due to the number of residents that we lost. He did some memorial services for our staff that really were so in the moment and didn't have really time to grieve. And, when the residents here are part of our staff members' family. So when you take care of somebody day in and day out for a month, a year, 2 years, 3 years, and then you lose them, you're losing a piece of you. So we had memorial services that we offered up to the staff. We have our psychologist that comes in for our residents, and he's also opened himself up to the staff if need be. So there's been a lot offered to the residents and the staff.
All right. Thank you. And Rini, just in terms of Grada's response, if this continues for a long time, do you see this being Grada's focus for a long time? And any other final thoughts you want to add from Grada's perspective?
I think there are three things I wanted to add. One is absolutely, I think I'm very privileged that the Grada Fund council members are very attuned to wanting to be responsive as well as looking ahead. So if this is a need, this will be something that they will want to support. In addition, I think our age-friendly community leaders are culling together new technology for older adults. So stay tuned. There will be a discussion of all different types of technology for older adults, which will help with addressing social isolation, as well as ways that people can be trained to get on the technology and getting some more technology in the home. And I think the other is what we're hoping to do in addition to our funding is what we did in the past, what we will do again, is to try to guide our various grantees and members of the community, including our federation agencies, and our opportunities for additional funding. So we hope to be able to spread what people are learning and spread new funding, as well as looking ahead with services that would help people.
Great. Thank you, Rini. Thank you to all the panelists. In wrapping up, I just wanted to just give a little broad perspective here. So as you know, you heard a lot about, the Federation's incredible response. I can only say that I have never been so proud as this moment in time to work for our Federation and Jewish Community Foundation. I am the executive director of the JCF. We are the plan giving and endowment arm of the Federation. We've been working hand in hand. We've always worked hand in hand for the last 60 years, but we've really been working hand in hand with Federation and all of our partner agencies in these last few months. Just to give a big perspective on the numbers, on the dollars, as close to $6 million has been collected, right? That in response to, or collected, and a lot of it has been dispersed already in response to COVID-19. I am including $1.2 million from the Federation's emergency funds. And I know both Gina and Susan referred to getting different funds for specific things that came out of those Federation emergency dollars to many of our agencies, in particular those frontline agencies like Daughters and JCC, as well as that big number includes also one-time gifts by donors to the Federation's annual campaign Increase Gifts that will be helping us in the year ahead, as well as targeted major gifts from major donors, as well as almost $3 million from the Jewish Community Foundation that has gone out either into this community, to synagogues, to national organizations, to Israel, around the world, globally. Some of it secular, most of it Jew. About 90% of those dollars coming out of the JCF are to Jewish agencies. So an incredible response, and it continues. And the crisis continues, and we are continuing the work. And that is one of the reasons that we are holding the Jewish Community Foundation Center for Strategic Strategic Philanthropy is holding these seminars to inform both our fund holders and broader community about the needs. So thank you so much for the presenters for the informative presentations. Just quickly, the JCF Center for Strategic Philanthropy, our mission is that we engage with our fund holders, often multi-generationally, to encourage Jewish philanthropy. We educate, like we do today, on needs, particularly in the Jewish community, and we innovate. We have an innovations fund, and we work with fund holders together, bringing them together around common causes. So thank you so much for being part of the JCF's Center for Strategic Philanthropy webinar. We have a few remaining webinars. July 16th is Jewish education. July 30th will be mental health, as I referred to. August 13th is special needs, and August 27th will be Israel and overseas. So we welcome all the participants to continue along with us on this learning journey. I am learning as well, and it's very exciting and gratifying to be part of this. Thank you all for joining.
Thank you for including me, everybody. Thank you.
Okay.
Thanks, everybody.
Thank you. Stay safe.